Hey folks, what's going on? Today's post is per request off of yesterday's post. I was asked what to do for quadricep tendonitis. Well, before we discuss that, let's go over what that is first. So, the quadriceps are made of the vastus medialis, which is the teardrop, okay, your vastus lateralis, which was in the post yesterday, your rectus femoris, which is that big front part of that quad muscle, and underneath that is the vastus intermedialis, okay. All four of those run from up here in the hip area down towards the patella and connect to the patella, go across the patella and become the patellar tendon, which then connects to the tibia. So basically, if all four of these muscles, these big front muscles, are going down in one conjunction and becoming one tendon, of course there's going to be a lot of potential for issues with the tissues there. How does this happen? Well, this is from poor biomechanics, poor exercise routines. This could be from an abrupt or aggressive motion that requires excessive force on that patellar tendon and that quadricep tendon. And it also could just be due to degeneration of age and time. Now, some of the things you can do, you'd want to, if it's an extreme case, you'd want to go see a doctor. Rest, ice, compression, elevation is something that they'll probably have you do. Shortly after that, my recommendation, and if it's not too severe where you run into the doctor, is soft tissue work, folks. Self-myofascial release. Go ahead and grab your peanut. All right. So you're going to have, in quadricep tendonitis, you're going to have a lot of pain top of the front knee here, right in this area. So what we're going to do is gently start off working that area with the peanut. Just put in a single spear. Okay. So unispearing right above where that kneecap is, and just sink in. And just relax. It's going to hurt, especially if you have the symptom here. And then you can just kind of maneuver around, push the tissue around. Alright, start working your way up. Alright, if it hurts too much, you could use the groove in that same area. So you're going to kind of be getting both the outside part and the inside part of the quadricep tendon. And that's where pretty much the tissue is starting to become tendon, so it'll be a little less aggressive. You just can push that blood around. Relax, sink in, you can lay down, you can bend your knee, you can extend your knee. Alright, just play around with it, but the key is to be compliant, folks. A lot of bouts of short time of tissue work is going to help to take that inflammation down. Thanks for the inquiry, and thanks for watching, folks. Make sure you drink plenty of water, and go ahead and grab your peanut.